The information provided in the Health After 30 podcast is for general information purposes only and should not be considered as medical advice. It's not intended to diagnose, treat, cure, or prevent any disease or health condition. Always consult with your qualified healthcare professional before making any decisions related to your health or before starting a new treatment or health regime. You're tuned in to the Health After 30 podcast, and if you menstruate, you are going to go through perimenopause at some stage. And today's episode is all about how to go through this season change, feeling healthy and vibrant when you do. Hello friends, and welcome back to another episode of the Health After 30 podcast. Alana Bonnemann here with you. And today I am delighted to have Kimberly Verbeke on the show with me. She's a naturopathic practitioner and also a peptide bioregulator specialist. She works on achieving good aging naturally and longevity. So naturally, the perimenopausal, postmenopausal, menopausal stage is all a part of this. Today's episode, we're focusing on the perimenopausal change, the transition, the shift that menstruating women go through, and how we can bring in natural ways, a holistic way to kind of waver through this transition. I'm so delighted to have Kimberly on the show today, so let's get into today's episode. Hey, I'm Alana Bonnemann, naturopath and holistic nutritionist. This podcast is dedicated to reclaiming your health by harnessing yourself as your biggest asset. Get ready, because this is where we stand up for your body's ability to heal, go against outdated norms, and say yes to change, creating true and lasting success, all from the inside out. Thank you so much for being here. This is the Health After 30 podcast, and let's get started. Hi Kimberly, thank you for joining me today on the Health After 30 podcast.
Hi, I'm so excited to be here. We have so much good stuff to talk about.
We do have a lot to talk about. A big topic which is affecting half of the world's population, something that's not really talked about and needs to be talked about more. And this is perimenopause. And I think I want to start today's episode with perhaps defining what is perimenopause. Are we experiencing it? What's happening? What's going on? So can we get back to, can you please define for us what perimenopause is?
Yeah, so it's kind of that period, right, as you're edging towards menopause and you start to see changes in your cycle, changes in your hormones, maybe changes in your mood. You recognize something's changing, and you're still getting your cycle, but things just aren't quite what they used to be. That to me is kind of that perimenopausal stage.
Because I feel like there's so much research done on menopause. Everyone knows when they've hit menopause. It's like one day and it's kind of done and dusted. And you kind of know when you get your period as well. And then there's this regular cycle that most of us have. Some of us, not all of us have it, but a regular cycle that we'll get. And then things start to change. And I feel as women, as we age, as we get over 30, as we go into our 40s, and then coming into our 50s, there is this, I feel like it's a no man's land where you don't know if it's normal or what is normal even in this time. Mm-hmm. And then how do we go about going through that? So I guess first, what are the most common signs and symptoms of perimenopause?
I would say the most common signs I see in my practice are women coming in and they're like, my cycle's changing, maybe getting closer together, or just sporadic, right? I've lost my regularity. The other two things I see very, very commonly are sleep issues and a little anxiety, just feeling a little low. Those And they'll say, I've never really felt this way, but my sleep, I'm waking up a lot during the night, or, I feel anxious for no reason. That seems to be really, really common in the women that I see.
Yeah, I find that to be a bit dubious as well sometimes, because just with the state of the world, these feelings of anxiety, the feelings of overwhelm, I mean, depending whether you have kids or how stressed you are, sleep is a massive issue. And if we're not thinking about that it's even our hormones that are having something to do with it, then we're kind of fumbling along life, missing a large part of what's actually happening.
Totally. And
Yeah.
missing out on the joy in our life, right? Because we're feeling, I don't know if you've ever felt anxious. I wouldn't say I have anxiety, but I
Yeah.
have had periods or things that have made me feel anxious. And wow, like you want to talk about something that just sucks the joy right out of your life? Worrying about every possible bad scenario.
Mm.
you know?
Yeah, absolutely. And it's, there's this wonderful saying that, you're worried sick. This is exactly, I often think sometimes are the elements that we have from the worry slash anxiety that we
Mhm.
have towards things, what's coming first and what's exacerbating either
Yeah.
side.
Yeah, I totally agree.
Yeah. Okay. So and also, I guess, what's the age bracket? I mean, I know there's no standard age bracket, but for perimenopause, what's the average age bracket of people going into this transition?
This is kind of a wild one, right? Like I know my mom didn't go through menopause till she was almost 60.
Mm.
I see women in their early to mid 20s that their hormones and cycles are changing regularly. It's wild. When you consider all the endocrine disruptors we have in our environment, it's a little less wild. And then you consider, you know, like there have been studies done on, like your cell phone, for example. Every time it dings, it creates this little, like this minute amount of panic, or like, I gotta see who that is. What is it? Right? There are all these things that are these stressors that aren't normal for us, right? And we may not think of it as a stressor, but it is a stressor on our nervous system that impacts our hormones.
Would
Yeah.
you say that that's the biggest thing or when you think about perimenopause coming earlier into age, is stress one of the biggest factors for that?
I think it is. And I'll tell you one of the reasons why I think it's having such an impact on women. Women have the only thing in the human body that really atrophies, and that's the ovaries, right? They just kind of shrivel up and stop working. And that's how we were created, right? It's how we're made. But when the ovaries atrophy, we need the adrenals to be really robust and healthy to take over a good portion of our hormone production. Guess what they can't do if they're already stressed? Can't
Regulate
take that extra,
hormones.
yeah, they can't take that extra workload. And so we feel even worse. So I am such a huge fan of having women start supporting the adrenals very early on. It seems to ease those symptoms, and they seem to manage kind of moving through that perimenopausal phase just easier, right? With less, like, so I'm going to tell you like my point of view, right? Like, I don't think we were meant to feel bad going through perimenopause and menopause. I don't
Like
think
it
we were
should be
meant.
a natural transition.
Yes, and people are like, "Oh gosh, it's going to be terrible." Why have we been conditioned to think that it's acceptable to feel terrible for this 5, 6, 7, who knows how long period of our life? Like, I don't think that's what we're meant for. I think we've kind of created this with our environments, but I think if we take a step back and look at things from kind of a perspective of how have we managed to exist as long as we have? We're adaptable creatures, right? And so it's about going, okay, we've had changes in our environment. How do we adapt to those changes in a way that promotes homeostasis and really just promotes us still feeling well and feeling happy and enjoying our lives? It's just a different stage of our life.
If you're like most people that tune into the Health After 30 podcast, you know that good health and quality of life go hand in hand. And rather than focusing on our lifespan, we want to start focusing on our health span. How can we get into old age and keep up with the things that we love? How do we promote longevity? Today's sponsor is Kimberly Verbeke. She's a naturopathic colleague who does exactly this. She uses peptide bioregulators with a longevity protocol to enhance energy, increase mental focus, and balance our hormones as we age. If this is something you want, if thriving in old age speaks to you, then please check out all the links below and see if Kimberly can help you today. I can imagine that's also very difficult for someone who has experienced menstrual irregularities or dysfunction for most of their menstruating life, to then come in to go through perimenopause and menopause with ease. So that can be really difficult. So when you talk about perhaps addressing the adrenal state, when should one start doing that? Can one start doing that from today? Is that something that everyone should be doing? Or is it kind of like, let's prep for menopause and then do it?
Yeah, I mean, I think that look at yourself as an individual, right? If you have kind of that ability to be introspective and go, I'm feeling different than I felt before, or my sleep isn't quite what it was, or I notice I'm a little more moody right before I get my period, or if you have the ability to be introspective, I think it's easier to determine when and what you need. I think that adaptogens can be wonderful in helping just be supportive of our cycle and our hormones. I'm a big fan of adrenal cortex for a lot of women. Does everyone need it? No. I mean, there's kind of no one size fits all, right? We're individual, but I think when women come in and we have a conversation and they are able to do a really good job articulating how they feel, even before I see labs, I'm like, oh, I think this is what they need to help support them through this period in their life. And it's, it can be tricky because when you're in the perimenopausal phase, you get a lot of this with the hormones.
Up
right?
and down and up and down.
And so it's like more so than just the natural cycle through the month. Like we get more, I think, bigger highs and lows, or it feels that way because that, maybe our hormones are dropping off, so we're getting lower than we've ever been. And, hormones play a big role in how we feel.
Yeah, absolutely.
So I think, finding things that can be supportive and help kind of support hormones being more stable. We're supposed to have some fluctuation. But when we get these really big dips, a lot of times that's when people feel pretty lousy.
And it's the get me out of here kind of state and back to feeling well again. And I think we know for most of us who have had this, like the monthly menstrual cycle, you kind of know when it's coming. 2 weeks you're feeling great, 2 weeks you're kind of going into winter and you kind of know what to expect. But when you don't know what to expect, you don't know when the next high is coming or the next low is coming, what can you do, I guess, to support yourself to balance those hormones so they're not so high and so low, but they're rather a bit more balanced?
I love when women are kind of in that perimenopausal phase and they need, like, let's say they are not on bioidentical hormone replacement, but they're not feeling optimal. Quicksilver makes some phenomenal products for women's hormones that, they're not the doses you would get if you go to a compounding pharmacy, but they just offer a little bit of support. I've found a lot of times those products work really lovely for women that are kind of in that perimenopausal phase.
Okay. And when you say Quicksilver, is this Quicksilver as a product or is this a brand Quicksilver? Or
the brand Quicksilver.
Explain to, okay. And so, okay. And
it's
so,
an American brand. They do a really lovely liposomal formula for DHEA along with adaptogens in it to help with your testosterone production. It's, absorbed sublingually. So if you have some gut issues, which so many people do, you get a much better absorption rate. And then topical progesterone and estradiol. They also have estriol. So you have some choices there. I've just found those products I've had really good success with them.
Yeah. And let's go a bit deeper there because gut health affects so much of everything in life. And I can imagine it would also impact in how we transition through this phase as well. What's a natural approach? Because of course there are a lot of different things that we can take. But first let's What's the most natural way, I guess, you could support your body to kind of, I want to say, prepare it through the process?
For menopause, or are we talking about gut health?
Let's go perimenopause and then using gut health as like the holistic approach to it.
Yeah, so, again, if you're kind of moving into that perimenopausal phase of your life, I think that really, really important to get your sleep dialed in, because that tends to get disrupted for a lot of women. And it's not like most of them don't have babies that they're dealing with now, right? That are kind of disrupting their sleep. It's just a lot of times they'll be like, oh, I'm super tired. I fall into bed. I'm exhausted. But then I just wake up and can't go back to sleep. And my mind's just, which is terrible. So I'm a big fan of dialing your sleep. Use some nice doses of magnesium that really support calming your nervous system. Sleep in a dark room. Make sure you're cool enough. Like, do the things that around sleep hygiene, right? Yeah. Because I'm a big believer that sleep is the foundation of our health. If we don't sleep, we don't heal and repair the way we should. So dialing in sleep, managing stress, and I'm a mom, I'm a wife, I'm a business owner. I know that's easier said than done. But I also think when it's important to you to prioritize your health, you do look for ways to go, I'm exhausted right now. I can't say yes to that. Or, right? Just those little things that make a difference and give you a little more time to just take care of yourself and recharge your personal internal battery.
Yeah, absolutely.
I think those are two really, really big ways that we can help ourselves during menopause.
Isn't that crazy? Because it's not, those two things are not even something that you would even connect with your menstrual cycle. Like, yes, in a way, very abstractly, but that's about taking the holistic approach, isn't it?
Yeah.
To really kind of dial in the things that are foundational and are affecting us, which are going to change, help us get through this change. So I'm looking forward to our next conversation and getting into that.
Me too.
But for now, for anyone who's listening and is kind of thinking, I'm going through perimenopause, I would like to perhaps know how to do waver through this transition, feeling healthy and feeling well and preparing myself for what's to come next. Where can they find you? Are you on Instagram?
Yeah.
I know you're on Instagram, actually.
I am on Instagram. That's where I'm the most active. My handle is Kimberly Verbeke Wellness. And you can find me on my website. You can book in for a discovery call, for a consult. And my website is avita-wellness.com.
Yeah. I'll pop it all into the links below as well.
Perfect.
Yeah. So I don't often like to say, is there one thing? Because there's never one thing. And I actually promote it never being one thing. If you ever focus on one thing, we'll realize that our overall health is actually somehow hindered. Yeah. If you could depart something with our listeners today that they could perhaps just take with them for the rest of their day or their evening, what would that be?
This is always my thing. When someone asks me if I have one last piece of encouragement or advice, if you are sick, know that your body is capable of healing. Your body was meant to be in homeostasis, and it's always trying to be. There are answers. It makes me so sad when I see people like they've kind of given up hope that they can get better. Just because you don't have the answer right now doesn't mean there's not an answer. So don't give up. Your body's capable of healing.
I love that. Put it in the right environment, and it will heal. It's not doing it against you,
Totally. That's what I say. Your body's not revolting against you. And I tell people often, you can't heal in the same environment that made you sick. Right? Think about that. And then go, what can I start changing that's going to allow me to heal?
Yeah. Beautiful. Thank you so much for being with me today, Kimberly. And I look forward to our next conversation.
So do I. Thank you so much for having me. It was great.
You're welcome. Thanks so much for being here. You could have been listening to anything, but you're here, interested in reclaiming your health. I hope you found the episode useful and constructive. If you enjoyed it and would like to show support for the show, please leave a review, as this makes my content more discoverable for other people to enjoy and learn from. Please also consider subscribing to the show on Spotify or Apple Podcasts or wherever you enjoy listening. Finally, the best way to show support for the show is by sharing it with someone who you think might benefit from it. Thanks for listening, be well, and I'll catch you next time.